Welcome to Friday's edition of COVID-19. It's been quite an eventful day so far as public inoculations were launched earlier this morning with locally manufactured AstraZeneca vaccines, while Pfizer's vaccines arrived at Incheon International Airport a few hours ago. Also, current social restrictions have been extended for 2 more weeks as authorities here recorded over 400 new cases on this Friday. Let's begin with the inoculation campaign then. Soa, to start us off.
Sure, Sunny. A year and a little over a month has passed since Korea has confirmed its first COVID-19 case here in the country, and now it has kicked off its mass vaccination program against the virus early this morning. Over 5,000 healthcare workers and patients under the age of 65 at high-risk facilities such as nursing hospitals are being inoculated with AstraZeneca's vaccine. And also today, the vaccine developed by Pfizer has arrived here in Korea, which will be administered beginning on Saturday. Some 117,000 doses, enough for 58,500 recipients, have touched down at Incheon International Airport around noon. This Friday, a panel of experts said Pfizer's product is 95% effective and also recommended its use on young people aged above 16. It's the second nod given by experts before the government makes a final decision on its approval as early as next week. The FDA, meanwhile, has given the green light to transport and store Pfizer vaccines at standard freezer temperatures for up to 2 weeks from an ultra-low temperature between -60 and -80 degrees Celsius. Whether that can also be applied here in Korea remains to be seen, as experts are saying they are going to review that is. Now, a quick update on the first inoculation here in the country. Now, both AstraZeneca vaccines and Pfizer vaccines supplied by the COVAX facility have now arrived here in the country. The shipment is done and the actual vaccination has kicked off here for some 289,000 people for the AstraZeneca vaccine. And beginning on Saturday, we will have some 55,000 frontline medical workers to treat COVID-19 patients subject to Pfizer vaccinations. Now, as officials have been saying, this is the beginning of a return to normalcy, but not the end of the pandemic.
The long-awaited vaccinations have begun, but we still have a long way to go until herd immunity is achieved, and a large number of medical staff will be needed for swift inoculation. If COVID-19 cases surge again before the majority of citizens have been inoculated, we could face a shortage of healthcare resources.
Right, and to avoid such a shortage, the government has extended the current social distancing measures, Soa.
Right, Sunny, for 2 more weeks, which means the metropolitan region will remain under level 2 social distancing measures until February 14th, and the rest of the nation under level 1.5 social distancing measures. And also the ban on private gatherings of 5 or more people remains in effect. And this as the country is still not seeing a clear easing of daily figures. We have 406 infections here reported this Friday, and that includes domestic transmissions in the high 300s. And that also means that's an increase from yesterday, as you can see here on our graph, and that also raises the total number of infections here in the country to almost 89,000. The death toll, meanwhile, stands at 1,585 with 4 additional fatalities. Now, let's take a quick look at where the new cases broke out. We have almost all districts with at least 1 case of the COVID-19 virus this Friday, and triple digits still in the capital, Seoul and Gyeonggi-do province. And let's also shift over to the figures abroad. We have the U.S. now surpassing 29 million infections, followed by 11 million in India and 10.39 million in Brazil. And there are many European countries which have now eased their lockdowns, but are warning of new waves of the virus, including here in Germany. Meanwhile, we have Iran surpassing 1.6 million cases. That's where Sunny will connect to in just a bit. And the total number of cases around the world now stands at 113.5 million, and we are seeing a surge in daily infections towards the end of the week. And those are the updates I have for now. I'll be back with more next week. Back to you, Sunny.
All right, so thank you for that. And staying on the international front, Iran, for its part, is seeking to strengthen its vaccination campaign as its death toll nears 60,000, the highest in the Middle East. For more on the situation there, I have Rustin Radva live on the line. Hello, Rustin.
Hello, Sunny. Thank you for having me.
Right, Rustin, public inoculation there began on the 9th of February with Russia's vaccine. I also understand authorities recently approved, or gave the green light that is, to AstraZeneca's vaccines, those that have been manufactured here in Korea. Can you tell us a bit more about that?
Sure. Iran has started vaccination about 2 weeks ago with the Russian vaccine. The first group who receives it are medical teams who are working in ICU in different hospitals. But normal people are pushing the government for buying more doses of the vaccine so everybody can make it. Not buying vaccines from US and UK is a direct order from the supreme leader, but it seems like the reason of this order is to don't have a direct contact with these countries due to political disagreement. But it seems like medical groups in Iran are trying to convince authorities to not act political, where the lives of people are on the line.
I see. Meanwhile, Rustin, how is Tehran responding to talks with Seoul regarding the possible release of its funds frozen here amid Washington sanctions?
In a meeting earlier this week, the head of Iranian Central Bank and ambassador of South Korea in Iran talked about the relation between two countries and, of course, Iran's frozen funds. In a meeting with journalists, the CEO of Central Bank added that they reached an agreement that Korea will pay $7 million in the first step. Meanwhile, in the international media, we see Korea wants to go. We see that Korea wants to talk with Americans about these payments first, and it's not clear if it's going to happen anytime soon or not. Also, Iran is still looking for reparation because of the economic damages Iranian government and society faced in the recent years due to the frozen money in Korean banks.
I see. Meanwhile, back on the COVID-19 situation, Rustin, I hear more than 8,000 cases have been recorded on a daily basis in recent days there. How severe is the situation in Iran? And do authorities believe their vaccination campaign will serve to push the infection numbers down in the near future?
At the moment, there are worries about the mutated virus, which is officials confirm that they found some examples of it in different cities. But in overall, daily cases are about 8,000 cases per day, and also the average of death toll is 80% per day. Iranians are not happy with the government's actions and measures. They are pushing on social media for buying more vaccines and start the public vaccination for everyone. And there is not an exact time confirmed by the government when people can access the vaccine. In the rumors, everyone hoped to start the general vaccination from April, maybe.
I see. All right, Rustin, thank you very much for making the time to join us live at this hour with your thoughts.
Thank you. Thank you so much.
Right, back here on the local front for a broader coverage of our vaccination campaign, which kicked off early this morning. I have Kim Sung-hyun here in the studio. Good to have you with us again, Sung-hyun.
Good afternoon, Sunny.
Right, first then, I hear authorities have been seeking to keep the spotlight away from any single person amid their launch of public vaccinations this morning.
Right, Sunny. So unlike other nations around the world, the Korean government is saying that it's not so important who got the first shot here in the nation. Instead, that title will be shared by everybody who was among the first in line at vaccination centers across the country today. Now, Korea launched its public inoculation program with the rollout of AstraZeneca's vaccines this morning for workers and patients under the age of 65 at nursing centers. Yesterday, the government announced that it will not designate one person as the first to be vaccinated, with vaccines having been rolled out simultaneously at 9 a.m. today at more than 1,900 locations across the country. Korean health authorities said everyone who got their shots today will be regarded as the first to be inoculated. Let's take a listen.
Because vaccinations will take place simultaneously at long-term care facilities across the country, it's difficult to pinpoint who will be the first person to get vaccinated. Rather, that title will be shared by everyone who gets the first shot.
Meanwhile, President Moon Jae-in visited a public health center in Seoul's Mapogu district this morning and spoke with the first vaccine recipient there. The president was also briefed on the government's vaccination plan moving forward by KDCA Commissioner Chung Eun-kyung. The presidential office said Moon had arranged the visit to show his support for vaccination workers and also to encourage public participation in the inoculation program.
Right, Song-yeon, and speaking of public engagement in vaccination efforts, I believe the Prime Minister had also a few words to share.
That's right, Sunny. There's been a lot of uneasy rumors coming out regarding the safety of the vaccines, as we know. But authorities are calling on the entire public to have faith in the government at this point and join its vaccination drive. Now, the government reminded everybody of its goal to reach herd immunity through vaccines and said this would not be possible without everyone's participation. Let's take a listen to what Prime Minister Chung Se-kyun had to say yesterday regarding this matter.
Maintaining public trust is a crucial factor in the success of our vaccination program. If people do not have faith in the vaccines and refuse to get inoculated, our dream of herd immunity will end up as a mirage.
Right, now public inoculations began with AstraZeneca's vaccines. Song-yeon, tell us a bit about the merits.
Yes, so the government has said the AstraZeneca vaccines, they are more convenient for mass inoculation. This is because its storage temperature is 2 to 8 degrees Celsius compared to the Pfizer vaccine that requires ultra cold chain storage. Now, yesterday, trucks and ships carrying the first batch of some 1.57 million vaccine doses, they were distributed nationwide. Health authorities have taken extra caution to keep the vaccines at the right temperature range, which have been monitored around the clock since yesterday morning while they were waiting to be distributed.
The vaccines are being kept inside a special fridge at our health center's inoculation room. We're safely storing the vaccines at 3 to 4 degrees Celsius, and we have a system in place that automatically sends out an alert in case of temperature anomalies and allows us to monitor the vaccines around the clock.
According to health authorities, nearly 94% of all patients and staff working at mental health care facilities, as well as nursing and rehab centers, said they were willing to receive their first dose of AstraZeneca's vaccine. And all in all, the country hopes to achieve herd immunity by November after inoculating 70% of the whole population by September.
Right, staying with vaccines, I believe there's been another boost in confidence with regard to the efficacy of Pfizer's vaccines.
That's correct, Sunny. This is according to the first big real-world data study of the Pfizer-BioNTech vaccine. The peer-reviewed data shows that the shot is 94% effective in preventing COVID-19. Now, this could be a landmark study for countries desperate to end lockdowns and reopen their economies. Up until now, most data on the efficacy of COVID-19 vaccines has come under controlled conditions in clinical trials, leaving an element of uncertainty over how results would translate into the real world with its unpredictable variables. However, this latest research from Israel, 2 months into one of the world's fastest rollouts, provides a rich source of data. It showed that 2 Pfizer doses cut symptomatic COVID-19 cases by 94% across all age groups and severe illnesses by nearly as much as well. The study of about 1.2 million people also showed that a single shot was 57% effective in protecting against symptomatic infections after 2 weeks' time. Now, as was mentioned by Soa earlier on in the program, Korea's first shipment of Pfizer's vaccines, courtesy of the COVAX facility, they will be distributed to critical care workers nationwide starting tomorrow, Saturday.
Right, I see. All right, Song-yeon, as always, thank you very much for that.
The pleasure is mine.
Right, meanwhile, as our Song-yeon just mentioned, President Moon Jae-in early this morning was at Mapo in Western Seoul to witness firsthand the launch of Korea's vaccination campaign. Our Chun Song-cho is there right now. Hello, Song-cho.
Good afternoon, Sunny.
Right, Song-cho, fill us in on the latest there.
Yes, so I'm at a community health center in Mapogu district on the first day of the country's nationwide vaccine rollout. Well, when the clock struck 9 a.m. this morning, health officials here started administering the first shots of a 2-dose vaccine developed by AstraZeneca to people. Well, as of now, there are no more appointments for the day. And even earlier on, President Moon Jae-in was here to inspect the launch of the country's massive nationwide vaccination campaign. Well, we're in phase one right now, which means vaccines are available to high-risk individuals under age 65. That includes healthcare workers and patients in skilled nursing facilities, long-term care homes, and rehabilitation centers. Well, the reason why they're put at the top of the list is because they're more likely to come into contact and transmit the virus to the most vulnerable, the elderly. And also their work duties. They often have to work close to the older people without really being able to socially distance themselves. So people who are here earlier on in the morning to get the first jab obviously meet the current stage of vaccine eligibility. Well, those who work or stay in facilities with doctors on staff can get their injections there, but otherwise they'll have to come to public health centers like this one to get their vaccines. And for patients with reduced or limited mobility, doctors and nurses have been dispatched to the centers where they are to help administer vaccines. And as per the process of vaccination, well, doctors will examine the recipients first on how they're feeling and then inject the shots in their arms and put them under observation for 15 to 30 minutes post-vaccination for any immediate reactions they may have afterwards. So here are some words of advice from health experts to tell us what we should watch out for.
Well, actually, from the previous data, we have been reported about to 13% to 25%. There might have some mild symptoms after the vaccination, and then they might be like the fatigue or the headache or the muscle pain. But however, they will last like 2 days or so. But after that, they will disappear most of the time.
So especially after vaccination for 7 days, have a rest. And wear the mask and social distancing, you must keep it because your immunity is still low, is not enough to fight against the COVID-19. I like to say, human being always struggling against the virus unknown and the bacteria unknown, which is we are very new the first time, that's why we are so afraid, but probably we will forget it in 10 years. So don't be afraid about it. If you have vaccination, please tell your neighbor and your friends and your family, do together.
Well, the next available vaccines are likely to go to frontline health workers at general hospitals and then to the wider public gradually. The government's aim is to complete the first sets of vaccinations on 70% of population by September. And when the second dose of the vaccine is out of the way, then South Korea should be able to reach herd immunity by November. Well, this promising and optimistic outlook has many people hoping to finally see the light at the end of the pandemic tunnel and even daring to think about going on a plane ride and going to large social gatherings. But remember, these vaccines are not a force field around you that negates any chance that you will catch the virus or an illness. So continuing precautions at a time when community spread is evident and massive is the prudent thing to do, especially even when you're fully vaccinated. This has been Jeon Sung-cho reporting live from Mapogu, and back to you, Sunny, in the studio.
All right, Sung-cho, as always, thank you very much for that coverage.
솔직히 1년 동안 굉장히 불안했잖아요. 근데 백신을 맞으니까 일단은 안심되고 또 이제 이렇게 백신을 맞을 수 있게 이제 노력해 주신 뭐 정부나 구청이나 보건소 진짜 감사드리고요.
드디어 첫 접종을 시작하게 돼서 정말 기쁘고 안전하고 순조롭게 백신 접종이 진행돼서 집단 면역을 형성하여 하루빨리 일상으로 되돌아갈 수 있었으면 좋겠습니다.
Now that the vaccination has begun here in the country, we explore ways to ensure a productive campaign that promptly serves to pave the path to herd immunity by November, as targeted by local authorities. I have Dr. Kim Seung-taek here from Institute Pasteur Korea here in the studio. Welcome back, Dr. Kim.
Good afternoon.
And I also have Professor Sarah Ok Shin from Korea University. Welcome, Professor Shin.
Thank you for having me.
Right, Dr. Kim, early this morning, inoculations began roughly at around the same time at more than 1,900 nursing homes and public health centers. What are your thoughts?
Well, I think everything is going on as planned. And then, well, I think in terms of vaccination in this special pandemic situation, I think always number one is not always a good thing. I mean, for all the vaccines, now we have some clinical data, I mean, after the phase 3 clinical trials. And also, but sometimes even for like any new drugs or vaccination, we need to watch like some real world clinical data. But in terms of that, we have actually witnessed some real world data over some foreign countries, at least for like the 2 months, which is good. So, I mean, this number one is not always the best thing in this case. So, and it is in terms of this, and then our country has been somehow prepared, and then we have actually learned some lessons from the experiences in foreign countries, like some logistics issues and how just prioritizing issues. So I think that thing has to be just well addressed by all the experts and all those government people in terms of we actually did all the rehearsals and then some actually training. Yeah. So I think it would go just pretty well as planned. Yeah.
Right. Professor Shin, authorities here have refrained from turning the spotlight to one person to mark the launch of their inoculation campaign. How do you explain this stance?
Well, first of all, I think today is a historic day for us to start the massive vaccination. And I think we're putting a step forward to returning to our normal daily life. The government announced yesterday that number one vaccinee will not be designated as an individual, but rather they will start vaccinating at the same time across the country. And I think today, 9 a.m. today, we saw that all these people at nursing homes and facilities under age of 65 getting the vaccinations at the same time. And I understand that there were some political battles on the issues of whether the president should get the number one vaccinations or not. But I think the government rather prefer to focus on the preparation of the whole vaccination process. So from transportation to distribution and inoculation to go well, and also responding to any adverse effects that might occur. So I think the government made a good decision on that, and it's now we have to focus on this entire process of vaccination, and I think the public can actually feel confident, and they can be vaccinated with the confidence.
Right, hopefully. Dr. Kim, now that the inoculation campaign has kicked off, what remains crucial to ensuring herd immunity by November here in Korea?
I think the number one should be just securing just enough number of just vaccination, because some of the vaccination, probably we do not have the exact number of the exact just the date when we will get some the doses of the vaccine. So we need to just secure those vaccines first of all. And then I actually mentioned a couple of times in this place, and the current vaccination, it may not just protect just a sterilizing immunity, which means this vaccine gives immunity to disease, COVID-19 disease, but this may not just prevent infection, which is transmission. So then still we need some personal hygiene, like masking, just wearing mask and hand washing and then social distancing. And even after vaccination, maybe just a couple of weeks, just the immunity may not just develop fully. Maybe that is one of the reasons as well. So we need such kind of things as well.
Right. We take a moment now to turn our attention to Israel, where authorities say about 50% of their population of some 9 million people has been inoculated. I have Professor Cyril Cohen at Arirang University live on the line. Welcome, Professor Cohen.
Hello, Sunny. Hello, Professor Shin and Dr. Kim.
Right, Professor. I understand officials are limiting access to certain venues, including restaurants and gyms, to those who have been fully vaccinated by granting them green passes. What has been the public response to this measure, Professor Cohen?
Yes, hi. So this is actually the green pass that we are using. And I have to tell you that mostly because most of the people in Israel are already vaccinated and the vaccination is open to all from the age of 16. So we do not have much opposition to that because, again, if you want to get the vaccine, you can get it. And again, I would tell you that more than 85% of the people over the age of 60 already got the vaccination, and it goes also for the younger people slowly. So I have to tell you, we do not have a lot of opposition. Some people are complaining, but again, this is restricted. And in certain cases, even if you're not vaccinated or even if you didn't recover from the disease, this is the same category for us, you can get access with a PCR test, a negative PCR test.
I see. Professor Cohen, I believe our panelists here have a few questions for you as well. We'll start with you, Professor Shin, then.
Yeah, sure. Hi, Dr. Cohen. I have a question. So Israel is administering the Pfizer's vaccine to all citizens over age of 16. So are there any clinical data to show if there's any good efficacy and safety over the use of this vaccine on adolescent recipients?
Yeah, so basically what we have seen is that the efficacy is quite similar for all the ages. And these are good news. I mean, we were not really worried about the 16 and etc., but more for the 70 plus. And what we can see is that the efficacy is quite similar for those people. We do see a little bit more of, I would say, side effects, flu-like symptoms and fatigue and a little bit of fever in the younger population. But nothing that you cannot get rid of using, common, pain medicine. So everything seems fine, and we are very happy about that.
Right, that is quite encouraging because we got our second approval for Pfizer's vaccines for those above the age of 16 here in Korea as well today. Dr. Kim, I believe you also have a question for Professor Cohen.
Yes. Well, I know Israel is actually number one in terms of the vaccination rate, but still we have heard that daily about just 30,000 of confirmed cases are reported. Why is that?
Yeah, so basically if you analyze the data, you will discover that most of the cases, I would say more than 80% are people below the age of 40. And these are people that were not vaccinated until, a few weeks ago. And we know that the vaccination takes time in order to kick in. But we have very good numbers, I have to tell you. Besides, the high number of cases, we have seen a drop in severe cases in hospital, a drop in mortality of more than 60% in the past few weeks. So we do believe that we are into a scenario where we will still have a lot of cases, especially because we have 90% of infection because of the British variant. But on the other hand, less pressure on our hospitals.
I see. Meanwhile, Professor Cohen, what words of advice would you care to share with Korea as it begins its journey to securing herd immunity?
Yeah, so congratulations first on your first day of vaccination. It's a very auspicious day, I guess, for you. We've been in that, I would say, situation for 2 months. So again, a lot of communication is very important to help people understand the benefit of the vaccines. Logistic is crucial. I would say that you shouldn't waste any drop of the vaccine. Like we are doing, at the end of the day, we open vaccination for all we were opening vaccination for all if, we had some doses left. And you have to protect first the people at risk. You have to keep your masks because it's not over yet and the vaccination takes time. You have to be patient. And also you have to be aware of the variants. It's going to take some time. And even if we have, 50% of the population vaccinated, we are very, very cautious.
Professor Cohen, one final question. You talked about making the most of leftover vaccines as well. Are authorities there allowed to combine leftover vaccines?
No, actually, we do not do that. But what I was saying is that, at the end of the day, you have to throw away the doses. So we usually administered in the past. We gave them to people that were waiting in line, even if they were not in the specific category. That's what I meant.
I see. Thank you very much, Professor Cohen, for clarifying that. And as always, thank you very much for making the time to join us live at this hour.
My pleasure, and good luck.
Thank you very much. Right, Dr. Kim, then a shipment of AstraZeneca vaccines headed to Jeju Island was recalled in light of a slight drop in temperature for a brief period of time while it was in transit. Now, authorities have claimed the vaccines are fine and that they will not be destroyed. Do you share this stance?
Yeah, I actually agree with that. And the recommended range of temperature is 2 to 8 degrees, and then just a 0.5 degrees drop in this case. And then this adenovirus vector vaccine, and the adenovirus, in terms of just virology, adenovirus is like a naked virus, which means it has some protein capsid. So what I mean is that this virus is relatively stable compared to, like, for example, like some other enveloped virus, such as hepatitis B virus, hepatitis C, or HIV. So virus itself is relatively just stable than the other type of just the viruses. And then the 0.5 degrees drop, although I think this is not the best case, but unless the vaccine is not frozen, then it's completely fine. That's my guess. And if it is like the frozen, then it actually ultimately affects some physical properties of the vaccine. This is a virus particle anyway, and this would eventually affect some infectivity. So this vaccine is basically just based on the infection of the adenoviruses. So this type of just a small drop would not just affect the efficacy of the vaccine.
I see. Professor Shin, Pfizer officials have reportedly disclosed data showing their vaccine can be stored in a normal freezer for at least 2 weeks. What are your thoughts on this?
Yeah, so we know that Pfizer vaccine gives us, the highest protection rate in real-world clinical data. But as we know, the downside of using Pfizer vaccine is the storage and distribution. So it is thought that the Pfizer vaccine, when it was first approved, it has to be kept at ultra cold temperature from minus 80 to 60 degrees. So this was very, concerning because, that's because the essential part of this messenger RNA vaccine called lipid nanoparticles, it's rather temperature sensitive. So that's why they wanted to keep this temperature, the cold chain, to be very ultra cold. But Pfizer has announced that they have been doing these stability studies, and now it is okay to store these vaccines at regular freezer for 2 weeks. And I think that's very good news because it will expand the number of sites where the vaccines can be inoculated. And that means more people can receive the vaccines, including rural areas or developing countries where they don't have the access to ultra cold freezer. So I think it's very good news. But regarding the safety issues, I think the Pfizer vaccine so far there were very few rare cases of side effects reported, such as anaphylaxis. So I think using this regular freezer storage is not going to cause a lot of safety issues. I hope. But I think we'll have to see if there's any effect on the efficacy and the safety in other countries as well.
Right.
Yeah.
Meanwhile, Dr. Kim, earlier this morning, the Pfizer vaccine to be brought into the country, that has been brought into the country through the COVAX facility, received a second recommendation by medical experts with regard to their use on those aged 16 and above. What are your thoughts on this?
Well, that was actually the issue just previously discussed in foreign countries as well. And I think most of the vaccine is recommended for the people aged over 18, but Pfizer one is probably the 16. And then since all the vaccines, any just drugs, we also in our Korean, once before just coming to Korea, we also just experts just meet together and to discuss whether we have to just use this kind of therapeutics or vaccines in the Korean people. So this is part of just such a process. And then the good thing is those over the 16 years of just the people are just acknowledged. I mean, just already just acknowledged for the people who can be vaccinated by the Pfizer vaccine. So I think there is going to be no problem.
Right. Professor Shin, I spoke about this with Professor Cohen earlier on, but what are your thoughts on providing people with perhaps vaccine passports, so to speak, to encourage public engagement with the vaccination campaign?
Yeah, well, I think, as Dr. Cohen said, I think it's very important. And now we have to continue with the campaign to, strictly actively abide by the social distancing rules. And I think that's very important.
So do you think having such an approved green passport might actually encourage people to get more vaccines in the country as well?
Sure, yeah,
Right.
I think so.
Right.
Mm-hmm.
Dr. Kim, we talked about leftover vaccines as well with Professor Cohen, and there are some pharmacists over in the US talking about the need to perhaps pool these vaccines to ensure more doses, given the shortage worldwide. What are your thoughts on this?
Well, as far as I know, there was some sort of just a major paper that was just discussed just previously, and the paper is actually published in the Lancet paper, and that there was about some data on the real world data that vaccinated by the Pfizer or Moderna vaccines, even after they just got the first shot, they got just pretty good just immune responses. So that based on that data, some people in the the White House and then arguing that maybe just one shot, maybe because of some shortage of the supplies. But then I think we have to actually just focus on that those data. The data is not really, really comprehensive. Even these authors of the data actually acknowledge that all the subjects in this data is mostly healthy and young, which means that they are very immunologically very active. So even maybe after one shot, their response was pretty good. But then one of the actually drawback in this study is also that most of the people actually got the second shot as well. So then we do not know how the immunity they developed after first shot will last. We do not know how long it will last. So actually degree just kind of a durability and then the immune response and all those subjects are something we have to just concern. And then because this is a very urgent situation, so somehow people are just very keen to watch the very recent update in any therapeutics and then vaccine development. So even even before any peer review title or some simple fact can be the front line of the major broadcasting. But then we somehow experts need to very carefully all the data before saying, well, this is okay to just proceed or not. But in this case, I think based on all the data we have right now, I think just following the protocol as was provided by the FDA and then the CDC would be safer.
Right. And this also is an impromptu question, Professor Shin, but there are studies overseas with the idea of mixing and matching vaccines, the ones that require 2 doses. As a medical expert yourself, what are your thoughts on the mixing and matching of vaccines?
Well, so I know that Russian vaccine is using the same platform as the adenovirus vector, just like the AstraZeneca vaccines. So I think there's a disadvantage of AstraZeneca vaccine because they have to have a long interval between the first inoculation to second inoculation.
It's about 12
right?
weeks or so.
Right. But if we could use the Russian vaccine for the second inoculation as a mix match, but I don't know if that's gonna be feasible, realistically feasible, but I think if it can give us the high efficacy rate, then I think that's going to be really excellent choice, given that we have the shortage of all these vaccine productions, right? So in that case, using the same platform, vaccine technology, mixed match might be okay.
Right.
But I don't know about whether using the mRNA vaccine for the first inoculation and then adenovirus vector vaccine for the second inoculation, I don't know if that's gonna be okay or not.
Right. Dr. Kim, Korea has manufacturing capacity of COVID-19 vaccines, which is why we have AstraZeneca's vaccines been manufactured here locally by SK Bioscience. Do you believe such capacity, which is lacking in countries like, for example, Canada, gives Korea an advantage with regard to global shortages of vaccine supplies?
I think, yeah, as you said, the manufacturing itself, Korea has a pretty good just capability. And then, so as you said, we are the SK Bioscience is responsible for manufacturing the AstraZeneca vaccine and also Novavax vaccine, which is good. And then, according to some reports, and then probably just company will just receive also some technology, probably from the for example, probably Novavax and things like that. So then we maybe just increase our capability, just not just manufacturing, but we just design and then just creating our own just vaccines as well. So this is good, yeah.
And speaking about creating our own vaccines, Dr. Kim, where do we stand with regard to vaccine development here in Korea?
Well, the people, some companies are actually developing some DNA-based vaccine, and then some people the protein subunit vaccine. But I think just most advanced, the front one is probably some protein subunit vaccines. And then one of the concerns at the moment is whether and how we can just proceed with the phase 3 clinical trials in this case. So the government and then some experts are discussing about some ICP, which is immunological correlate of protection, which means instead of trying like more than tens of thousands of people, maybe just using such kind of some correlate, we can actually we can just facilitate some clinical trials. But then this type of just establishing such a standard needs some global, probably some agreement. And then I think just the government is just working on that too.
I see.
Yeah.
Professor Jaein, authorities here have also extended the current social distancing guidelines for 2 more weeks amid the persistent presence of cluster infections. What are your thoughts on this?
Yeah, although we still have a ban on gathering of more than 5 people in the crowds in public, I think especially, weather is getting warmer and people want to go outside and spend more time together. So I think it's still worrisome. And I think because, more movements we get, more personal contacts we might create, and that means, more viral spreading we might get. So I think we still have to, actively abide by these social distancing guidelines, and we try to minimize human contacts as much as possible.
Right. And Dr. Kim, what are some words of some precautions that need to be kept in mind as we seek a path to herd immunity?
Well, I think I talked about a few of them. The first one is vaccination is very important. Obviously, vaccination is very important, and the personal hygiene, which is wearing masks and hand washing, and then the social distancing. And then because the reasons that I have already talked about that. And also, in this some very critical moment, there are many just fake news. And even including some anti-vax groups. So we have to somehow just control some those fake news sources. And then just we as people as a general, and we have just listened to the experts' voice.
Right.
Yeah.
And staying with that, Professor Shin, we look to start schools next week, that is. What are your words of advice?
Well, as Dr. Kim has mentioned, keep the social distancing maintained, and keep the personal hygiene going, maintaining at school, especially for the teachers and for the students. It is important to have the personal distance, right? So.
And because you mentioned teachers, I ask you, some are calling for the vaccinations of teachers as well to take place earlier because school needs to start.
Right.
What are your thoughts on this?
Well, I think, right now, teachers are not at the top priority group, right? But because we have to really vaccinate the aged group first, over 65. So after we can vaccinate all these more vulnerable groups first, then we can think about, vaccinating the teachers group, I think.
And as a doctor, when we talk about vaccinations, Professor Shin, what are some of the precautions we need to take while being vaccinated, after our vaccination, that is?
Well, they say that you have to remain at the vaccination sites for more than 15 to 30 minutes, so that, in case you have any rashes or soreness or fever or shock in severe cases. Hopefully you don't have that, but so you have to remain at the vaccination site. So unless, in case you develop all these side effects, but
for at least 15 minutes, is it, or half an hour?
15 to 30 minutes, they recommend. And then after you go home, you have to really monitor yourself, and you have to drink a lot of water before you go to vaccination sites. And that's a recommendation. Right.
All right, Professor Jaein, as always, thank you very much for your thoughts. And
Thank
Dr.
you.
Kim, thank you very much for being with us today. Right, we are indeed starting a new chapter in our battle against the pandemic, given the launch of public inoculations, and authorities are calling for continued public caution as we seek a tangible path to herd immunity. Thank you for watching. See you next week.